Hey mamas, Nurse Lana here. Today we're going to talk about 4 terrifying things about delivery that nobody is talking about and how to survive them. Usually when we talk about labor, delivery, we think about the baby, of course, and the joy that it brings and how wonderful it is and all the cute and wonderful things. But over and over again I hear my patients saying, how come nobody told me about this stuff? What stuff are they talking about? Well, one of the things that is in the back of the mind of most women, but nobody's talking about, is pooping. A lot of women are worried about pooping when they are delivering. And the truth is, you're going to push hard. And most of the time, what we tell you is push like you're having a big poop. So, yes, you're going to poop. But guess what? We're used to it. We don't care. Nurses are really good, usually, at being super discreet and wiping it away before anyone else even notices it, and keeping the area clean for the doctor and for the baby when they come through. And you'll realize it once you're there. When everything is happening, that's the furthest thing from your mind at that point. So just relax. The second worry a lot of women have, or maybe they don't even worry about it, but later they wish they had known, is tearing. Tearing down in the perineum and the vagina. The area of the vagina, which is the inside walls, and the perineum, which is that area between the opening of the vagina and the anus. That whole little area right there sometimes can tear. There's different categories of tears. There's first degree, second degree, third degree, and fourth degree. First degree is just a little tear. Some doctors will put a stitch or two in there. Some doctors won't even have to stitch it up at all, depending on what's going on. Fourth degree, you tear all the way through and rip open the anus as well. The whole thing's open. Second and third is in between. So anything from barely anything to everything's torn open can happen. Most of the tears I feel like are second degree, in the middle. If it's your first baby especially, it's the first time all that tissues and all those muscles are stretching, so you're more likely to tear more. If your baby is bigger than a previous one, you could tear. Sometimes it depends on the experience of the doctor and the person guiding you through the pushing and telling you once the head is there for you to slow down and let it stretch. It depends if baby is doing okay and can tolerate sitting there and letting your perineum stretch, or if we need to get baby out because the heart rate's dropping. There are a lot of different reasons why you might tear more or less, and there's just too many variables that we can't get into. But know this, there will be so much hormones, so much excitement, and everything else going on that you probably won't even notice it at the time. If you have an epidural, it'll be all numb down there. If you don't, the doctor will numb you up before they sew you up. Most women don't even realize that they had a tear and the doctor's repairing it until it's all over. They're so focused on their sweet new baby in their arms. And you're just looking at your baby, checking if there's hands and feet and fingers and toes and if everything's there, focusing on trying to get the first latch and all those things. Later on, the nurse will help teach you your routine of what to do to help care for that. And I'll do another video just on that. So number 3 is peeing. Peeing is one of those worries that most women have when it comes to giving birth. So most patients that I help up to the bathroom for the first time after they've delivered are worried about peeing. They're worried about burning. There's tearing and there's stitching and everything's kind of sore down there. So the hospital will provide you with a peri bottle, which is a plastic bottle that has a little tip, kind of like a sports bottle that you can squirt water. And so when you go to pee, you take that peri bottle with some warm water in it, and you're going to just squirt while you pee so it dilutes that acidic pee and it doesn't burn as much whenever you have to go pee. And you can just refill that every time you go to the bathroom for probably a week or two and just use that every time you go pee. And there will be a whole routine that we'll talk about in another video. Another worry related to peeing is if you had to have a catheter. So a urinary catheter is that little tube that goes up your urethra that helps drain your bladder when you're not able to get up and go pee. A lot of women get that when they have an epidural because you can't walk to go to the bathroom and pee. Depending on how long you've had that in for, you almost have to retrain your bladder and retrain your body to go pee. So some women have a little bit of a hard time having that first pee. Not everyone, but some. We have some tricks to help you with that. Some things that you can do is, of course, the whole cliche, think about a babbling brook, a waterfall, things like that. Then you can also put your hand inside a bowl of warm water, or you can get a straw in a cup and blow bubbles inside the cup. When you blow bubbles, it helps you relax the muscles down below that are tight and keeping you from going pee. So nurses have all kinds of little tricks, and your nurse might have some other tricks that I didn't talk about to help you pee. So know that we're used to dealing with it, to helping you, and we'll have some tricks up our sleeves. The fourth worry that women have when it comes to giving birth is bleeding. So bleeding is a normal part of delivery. There will be some blood that will come out, especially when the placenta detaches and comes. There will be some bleeding from the tearing that you had, and we will keep track of how much blood by measuring how much comes out. We will also check your blood with lab work before and after to see if you need any help as far as getting blood or getting iron. Most women lose an amount that is not worrisome and we don't need to do anything about, and your body just recovers. You will most likely have what is equivalent to a medium to heavy period for anywhere from 10 days to 3 weeks. During that time, you will be wearing a pad, no tampons, nothing inside the vagina, usually for at least 6 weeks or until your doctor tells you that it's okay to have something in there. During that time, like I said, the regular period kind of bleeding is normal. Now, a pad that's about, this big, if you're soaking that all the way through, side to side, front to back, every hour, we consider that too much bleeding. Anything less than that is actually considered okay. So if you're only having to change your pad every 2 hours, every 3 hours, even if it seems like more bleeding than you're used to, it's still considered normal. Also, passing small clots are normal, but if you have a clot the size of an egg or the size of a golf ball or bigger, then we're worried. If you pass one of those in the hospital, push your call light button, let your nurse know. If you're at home, call your doctor's office and let them know. And as always, if you're ever unsure what you're having, like bleeding, is normal or not, don't hesitate to call a healthcare provider and double check with them if you're okay. I hope you found this helpful. If you want more notes and details, you can go to my blog, nurselana.com. And don't forget to subscribe, to like, and share so that we can help as many moms as possible. Nurse Lana sending love to all you mamas.